Hola a todos. Gracias, muchas gracias for being here. I mixed Spanish and English.
Muy buenas noches, bienvenidas, bienvenidos. Estamos reunidos desde la Casa Auvernia Saneo para el Online Virtual Education número 37 de este año. Muy felices, casi terminando el mes patria de septiembre del 2023, haciendo historia por primera vez, aunque no lo crean, en México, de la doctora Sandrine Sebban, así se pronuncia en francés, Sebban es igual de aceptado. A ti, doctor, que estás conectado en México y Latinoamérica, felizmente aquí un evento by Softfill y Filmed, saludando a todos los asesores comerciales, distribuidores autorizados y los que están haciendo la historia, ustedes, doctoras y doctores en Latinoamérica, incluyendo México. De México para el mundo con una pizca de Francia. Esta noche nos toca un tema muy interesante, la traducción de la doctora Sebban en vivo. Está abajo de tu pantalla en el globo terráqueo que te dice Translation, donde vas a tener la traducción simultánea del inglés al español. Muy felices de recibir a la doctora Sandrine Sebban. En pocas palabras, a nombre de nuestro grupo, queremos decir antes que nada gracias por estar aquí, por hacer algo que se llama pues un intercambio de información. Van ya 48 horas que está la doctora Sebban con nosotros y para que sepan, no viene a enseñar, viene a compartir y aprender. Y en lo que está aprendiendo de Latinoamérica es una suma de técnicas, de abordajes, de incluso productos y muchas otras armas que tenemos aquí. No hay en otros lados, ni en Estados Unidos, ni todos en Europa. Latinoamérica es un país y un continente bendito donde podemos hacer historia, pero es bueno intercambiar. Y la doctora Sandrine Sebban empezó hace más de 20 años, fue pionera, fue de las primeras doctoras en la medicina estética en Europa, a no solamente trabajar como doctora, como ponente, pero también como emprendedora. Es la historia de una mujer que en 20 años ha hecho historia como speaker, como creadora de la marca Softfill y de Topilase, 3 patentes. Recientemente acaba de vender su empresa, pero sigue siendo consultora para grupos Softfill y orgullosamente speaker para muchas marcas, haciendo historia desde los rellenos hasta las terapias combinadas. Y esa noche específicamente será un taller de Filmed y Softfill o cómo maximizar las combinaciones de las armas a tu disposición de la marca Filmed a través de las cánulas con el diámetro y la técnica y el método adecuado. Así que quiero agradecer a una mujer, mamá de 3 hijos, si fuera poco, cumplida como profesora, como empresaria y como mamá. ¿Qué más podría esperar? Pues aquí está, desvelada para ustedes y para Latinoamérica, con o sin jet lag, con la misma energía desde Francia, la doctora Sandrine Sebban para ustedes. Gracias a todos y a todas, doctoras y doctores. Disfruten la función. Nos vemos en un rato más para las preguntas y respuestas. Va a ser una noche de un poquito más de 2 horas encantadora. Gracias y felicidades por haberse conectado o estar aquí presencialmente con nosotros en Casa Auvernia Saneo. Buenas noches. Merci, Sandrine.
Merci. Thank you very much. Gracias. Okay, so I begin just to introduce me. Of course, you know that I'm French. I'm French aesthetic doctor at the beginning, and I own my clinic in Paris, in the center of Paris. And I work for more than 23 years in aesthetic field. So you have understood that I'm really passionate by our field. I think we have so much to learn and to give. And I created Softfill company in 2009 after, you understand, after 10 years of injection in my office, because I wanted to help doctors, practitioners, and patients to be in perfect condition. I mean comfort, safety, and very natural result, as we love in France with this kind of French touch. So at first you have to know that when we injected before, in this period, you know, in between 2000 and 2010, we had some products for injecting. At the beginning, before 2000, we had silicone, we had collagen, but it was, of course, you know, everybody knows that it was not so safe. silicone was not resorbable, and collagen was with animal product. So I didn't inject at this time. And when hyaluronic acid was launched, I was to the first IMCAS Congress, the first one. We were 100 people, only French. It was, for me, the beginning of my passion, because I saw how we can give, you know, happiness to our patient. And for me, it was so important. And in the same time, it was creative discipline, and I love that. So I think that during this time, it was very interesting because we had hyaluronic acid, but only one kind of product. It was a basic hyaluronic acid that, you know, like in Filmed, it's the universal. And we had only that. So we tried to inject the wrinkles, the nasolabial fold. We were injected expression wrinkles only with, of course, botulinum toxin that we know for a long time. And slowly by slowly, and thanks to different companies who are evolving when they are creating the hyaluronic acid, all products changed and evolved. Like they would like to manufacture a product thicker, adapted to different layers. So at this time, we understood that there was different layers in our face. We didn't know. We know, of course, that there was arteries, vein, and fat into the face, but we didn't know that it could be dangerous with HA. We had not the, you know, this information that HA is a viscous product, and viscous product into the face with a sharp needle could be dangerous. So at this time, in 2001 exactly, one person came to see me with a thick implant manufacturer with a syringe of volumizer. And he told me, please, Sandrine, can you help me, in your opinion, to know how to inject this safely? And they, at this moment, they put the 18 gauge needle into the box. So it was like, you know, very dangerous, of course, because to across the face with the 18 gauge needle and a thick implant, it could be very dangerous. So we were thinking about a way to be safer. And at this time, I was in Australia to launch a big product. After in Moscow with Mauricio De Mayo, we were launching together the product. And I was talking to, you know, Sidney Coleman, the surgeon who invented the fat transplant. And I talked to him, and we were thinking about this technique of fat transplant with microcannulas. It was dedicated for surgery, so it was sterile cannulas. But at this moment, I thought, but of course, it is the way to inject fillers. We have to use microcannulas in our office, but we need unique use microcannulas. So when I came in France, I find a manufacturer of needles, and I asked him to try to help me to manufacture one cannula for single use. And we did the range of 4 sizes of cannulas, and Softfill was born at this time in 2009. After that, I evolved with my technique, and I launched the soft filling technique in 2011. The soft filling technique is a simple technique to use with cannulas. Everywhere on the face, you can use a sharp needle and put the cannula on the skin. And after, in 2016, I developed the Stop Facial Aging method. You can have the publication in the JAMA journal. This method shows you how we can inject with a rigorous method, but reproducible in every face, how we can inject in different layers in 3 dimensions. You can inject in 4 or 5 dimensions with different products, but the same cannulas and the same entry point. So I propose you to go to read this, this publication. And after that, I created one new device. The device is the Easy Guide. We will see on the slides. Easy Guide is a new sharp needle to help us to introduce a cannula with only one gesture. Because sometimes I saw during the hands-on that the limit of the beginning of the treatment is this introduction of cannula. For beginners and for experts, sometimes it's hard to avoid the bruise, to avoid the trauma, only at this step. So I propose you to use the Easy Guide. You will see how we can use it. I saw so much doctors during 2 days here in Mexico, and I can tell you that I travel all over the world, but I know how you are strong in anatomy and how you want to give the best for your patient. I feel that. So I'm sure that you will love to use all these tools. And the last one that you don't know is I have created another product to help us in our daily practice. It's Topilase. Topilase, it's a topic hyaluronidase that you can use in your office to remove irregularities due to HA injection, sometimes in excess, sometimes migration of product on the face. So let's go to the presentation. So I told you that, of course, it's a, Softfeel is a French company. I was the CEO of Softfeel, but you have to know that last year I sold the company to a Canadian company, very strong, and you will have new development, and you will see that Softfeel is always innovative. The Softfeel cannulas are distributed in 90 countries today, and I hope that you will increase in Latin America, because I know how strong you are in the market. So those cannulas are dedicated for safety at first, for help you to have a very simple injection, and for comfort, your comfort and the comfort of the patient. Why using microcannulas? I'm sure that you have understood exactly why, but just for remind us the difference. The sharp needle is a rigid stainless steel tube, short usually, and very sharp at the tip. And the microcannula is flexible, round at the tip, very easy to inject in the fat, and the orifice is lateral. When you see a sharp needle, the orifice is in the middle. When you see a cannula, the orifice is just lateral. Usually, when we use a sharp needle, we need to use a lot of entry points. With cannulas, only few entry points, sometimes 2 only, for injecting the full face. I will show you different publications very quickly, but I'm very happy to see all these publications on cannulas, because we need it to prove you that it's safest, that it's more comfortable and less traumatic. So this first publication shows us that when we use cannulas, we have 77% less probabilities to go into a vessel. So it is a very large study with, which was done with 1.7 million syringes, with 380 clinic in dermatology. Here, another publication shows us how it's less painful, with less edema, less redness, less hematomas. I just want to stop the discussion here and to tell you that it's okay, but the tool is good, but you need to know how to use it, because I can give a cannula to an expert or to a beginner, and the result will not be the same. You can have bruise, you can have pain. So you know how to use it, and after, of course, you will have this kind of very good quality on cannula injection. This publication prove that we can be more homogeneous with filler, with the cannulas when we are injecting hyaluronic acid and fillers in general, compared to needles. Here there is another publication who shows how we can recover fastly after injected the face without edema, without, of course, erythemas. And another one prove the comfort that we can have with cannulas in comparison with needles. Of course, we can reach more areas with only one insertion point with cannulas. For example, if you want to treat the wrinkles on the jaw, the expression lines with a needle, you need to do many points. The result will not be perfectly homogeneous. So you have to use a cannula to, in France we say nappage. The nappage is when we use chocolate on the cake, you know, it's very regular, very beautiful, and very, well distributed. And of course, we can use less entry point with cannulas. So now let me show you the range of cannulas in Softfill company. The Softfill company contained the largest range of the market. So we have cannulas for face and cannulas for body injection. And as you know, of course, our field is evolving a lot, and now we are injecting the body, and mainly in Latin America, and in America, of course, more than Europe. So you know very well where is the demand of this kind of cannulas for body. And for face, we have different kind of cannulas. You know that the embassies contain different colors. This is the universal code of embassies as the needles. We have rigid cannulas, we have less rigid. The best balance between rigidity and flexibility, in my opinion, is the 23 gauge cannula. It's the best balance because it's flexible, rigid, but not too much in the 2 points. At the beginning, when I launched the product in 2009, the most important cannula sold were the 27 and the 30 gauge cannulas. But slowly by slowly, of course, the market changed, and we moved to the 25 and 23 gauge cannulas. 22 are very good too, but the most important sales are 25 and 23 cannulas. Usually we use 25 for superficial fat or deep fat, but at the moment you want to reach the periosteum, you have to use rigid cannulas like 22 or 23. For this one, it's very interesting because you can use it for filling the body, but the development will go to, spatula, cannulas with spatula in order to do good dissection when we are injecting. Okay. Now, let me show you how you present the box like this. You have inside 20 kits. One kit contains one cannula and one pre-hole sharp needle or one easy guide. It depends on what you prefer. Now, why Softfill is unique? Because some publications are proving that the tip of the cannula is the most important to avoid vascular occlusion. The roundest is the tip, the safest is the injection. So this is the roundest tip on the market. You can see here the orifice, lateral orifice. So you have to take it in account when you will work precisely For example, on the orbital rim, you have to know exactly where your product goes out. It's for that we have a landmark on the embassies. The red dot will show you where the products can be injected. And for example, when you inject the contour of the lips, you will see it on the workshop. You have to exactly have a very precise injection. If your red dot is go to the white lip, you can have diffusion and migration. So it's very important to take into account this landmark. Last thing that you have to know is that there is a graduation on the cannulas. All cannulas are graduated because the graduation can help you when you are injecting on a deep level to know where is the tip of the cannula. For example, if you have a cannula with 5 centimeter length and you have 4 centimeter inside and 1 outside, you can count and find where is the tip. This is interesting for beginners always to know this kind of landmarks on the cannulas. And I tell you that because one day you will be speaker, you will be trainer, so you have to show to your student how to use this kind of cannulas. Now you can see that the Luer lock. Sorry, we need the screen. Thank you. The Luer lock is very important on the embassies because when we are injecting with a cannula, if the length is very long and the implant is very viscous, you have a fragility here just at the junction between the cannula and the syringe. So you have to use usually a device like a forceps here just to secure the cannula to the syringe. It's very important, like that you avoid the expulsion of HA. Okay, let's go to the soft filling technique. This is the technique that you can use everywhere on the face. Of course, you can inject the forehead, you can inject the glabella, but you have to be careful because we have, of course, many danger in this area. You can inject the nose, zygomatic area, temples, nasolabial fold, lips, everywhere on the face. You can use cannulas, include the earlobe, the columella, everything is possible. And I didn't told you, but now we have a new cannula. You can't see it in this screen. No, it is not there. But you have a new cannula. The size is 13 millimeter, like a needle, with 26 gauge caliber. And it's like a needle, but it's round at the tip. So it's safer to inject the columella or earlobe, for example. It's dedicated for this kind of indication. Now, you see here all indications that you can have with body cannulas. You can inject all the area of the body. Of course, it will require different sizes in terms of cannulas. If you inject, for example, hands or neck, it's not the same, but you can use cannulas for injection, for injecting the fillers. Now, this is the body cannulas. Today, we will focus on a face workshop. So, I want to show you at first the new needle that the name is Easy Guide. And what is Easy Guide? It's a pre-roll needle really dedicated for cannula injection. So I show you exactly the device. This device was awarded many times, and it contains 2 embassies for right-handed practitioner and left-handed practitioner. Of course, it is a gutter that you can see, and you slide the cannula on. It is a needle cut longitudinally. the most important point in manufacture of this product is to have a sharp tip on the needle. It's very hard when you cut the needle longitudinally to have something very sharp. It's really a challenge. And I did it. So now I need the computer. I go just to the computer. You can see here on the right screen, the video will show you how to use the cannula on the hand with Easy Guide. You see in 14 seconds, it was easy to go into the hand when I use the Easy Guide. If you observe how I try to insert the cannula in the left part of the screen, I promise you I was not, specifically for Easy Guide, but it was very hard because there is no fat here. And if you want to go inside, you lose time, it's hard, and the injection is very difficult. So now I continue. So the Easy Guide assets, it's just half a needle, I tell you. And something very interesting, it's that when you use Easy Guide, you are directly on the good level in the superficial fat, and you can push the Easy Guide a little bit more, and you will be in the deep fat. It depends on the area that you will treat. One gesture for inserting the cannula, you put the Easy Guide inside, you will see it on the workshop, and the cannula, and you will have a very good injection. Here, this is the sizes that contain the Easy Guide: 22, 23, 25, and 27. Now, let me tell you a short story about Topilaz. Topilaz is very useful in your clinic. Today, I use it in my daily practice because some patients are coming from other offices with problems. Sometimes it's Tyndall effect, sometimes it's granuloma, sometimes it's excess product in excess. So how can we manage this? Some patient doesn't want to use hyaluronidase injectable because they are worried about the quality of the skin. Some patient doesn't want because they are allergic. So it's very hard to propose this kind of treatment. And some countries, and in France it's forbidden, some countries doesn't allow the hyaluronidase injectable. So you can see here that it's a cosmetic product with a valve with 2 compartments. How to use the Topilaz, I will show you after, but here just to show you that in different congress and countries, there was a lot of award for Topilaz. And this is the product. So you can see here in the upper compartment, the enzymatic complex, which contain lipase, protease, and hyaluronidase. It doesn't act on the fat or on the conjunctive tissue. Into the lower valve, there is a solution who help the hyaluronidase to go through the skin with essential oils. For me, it was very important to have a 100% natural product. This is. And the other product was useful for recovering the firmness on the skin. Because when you use hyaluronidase injectable, the skin is very thin and lose the firmness immediately after. So we have 2 effects with Topilaz. One, chemical due to all components contained in the valve, and one is mechanical. But at the moment you apply the cream on the face, at the place you want to remove the excess or irregularity, you will change the viscosity of HA under the skin. So after, it's easy to move the product with your hand. For example, you can see here You know, it's very easy, the push and mix technology. You use a dispenser tip, and you can see here how to use it. You shake the valve, clean the area, just do a drawing where you want to apply the cream, press the button, of course, and after you use the brush, and you have to be very precise, because if you put the Topilaz everywhere, you can decrease the volume of HA injected before. And if you are a practitioner with HA on your face, be careful, because you have to put gloves, and after you can use Topilaz. Of course, after you can press the area you have applied the product, and you distribute the HA very easily. The protocol is simple. You have to open the valve. When you open the valve, you can keep the product in the fridge 2 weeks for 3 applications. If you have not opened the valve, you can keep it 2 years in your office. And why 3 sessions? Because sometimes the problem is coming from a viscous product with a high G prime. Sometimes the injection was done deeply. So if it's a superficial injection with a very light and fluid product, with 1 session, it's okay, it's effective. If you have to treat one person, for example, who was injected with a thick hyaluronic acid on the dark circle and deep, it's very hard to remove it. So you need 3 sessions, sometimes 4. And if you can't remove it with Topilaz, of course, you can use hyaluronidase. It's not a product dedicated for vascular occlusion, but I had a case in my office, and I tell you the true story, that I had injected a shin with a needle, and the patient came the day after with a black area here. I think it was a vascular occlusion. And I have the doubt of this, and I tried Topilaz. I asked the patient to wait a little bit. I tried Topilaz. I apply and do a strong massage during half an hour, and she goes out without anything. The color came back, and the black disappeared. You know, so it was effective. I don't recommend to use Topilaz for this, but during the time, if one day you have a vascular occlusion in your office, you can ask your assistant to apply Topilaz the time you use the hyaluronidase. It can help. Okay, so now clinical results from many doctors. We have a lot of case reports. This case, it's my patient. She came from another office with a Tyndall effect. You see the migration of HA in the infraorbital region. Usually with old patients like this, she was a 76-year-old at this time. And it's very hard, you know, to recover the firmness of the skin, because she has a very thin skin. And with hyaluronidase, usually they have, you know, a lot of skin. And she was okay. After 4 sessions, she recovered the firmness of her skin. Another case, you see here the interest of Topilaz. We move the product in excess here to the hollow, just below, upper the problem. And you know, the interest is you can distribute the product better. After here, another case of excess of HA in the infraorbital region. Another one from a Spanish doctor, irregularity due to malposition on the infraorbital region. Here too, this is the most important area that we can treat with Topilaz. A Tyndall effect treated by 3 sessions of Topilaz with a Polish doctor here. The same. Another case with a patient which was allergic to hyaluronidase injectable, but it was okay with the cosmetic. So another one. and another one. There is a lot of cases reported by many doctors all over the world. So thank you for your attention. I hope that you have questions to ask me about different things. You can ask me now or during the workshop. And can we have the patient? If you have questions during this time, no hesitate. We are here for sharing. It's okay? Yes.
How well does it work on the white lip for the migration topillas?
Topillas. So you have to apply the topillas on the white lip. You have to wait a little bit, just 2 minutes. Like that, the product penetrates the skin. Sometimes some doctors are using a plastic film, like EMLA, to help the penetration. Sometimes they use a roller to help the penetration. And sometimes both, roller and plastic film, if the injection was deep. And after 2-3 minutes, you remove the plastic, you remove the cream, and you help the product to be distributed, and you will see the result. I hope that in one session it will be effective. If it's not, you ask the patient to come 7 days after, because the product the effect of the product continues 7 days after the application. So if you want to re-inject after, you have to wait 10 days. Okay? Yes? Exactly. Exactly. The question is, do I use more session if the product is highly cross-linked? So I think, of course, yes. You need to use more, not specifically more product, but more sessions. So probably 3 sessions or 4 sessions, it depends. But you will see, the patient will tell you that they feel something different, they move easier, the dynamic of the movement are more fluid. You will see when you try it sometimes on the nasolabial fold because it was too much injected, you will see the patient telling you the feeling. Okay? So now let's go to the workshop. We have 1 hour, almost 1 hour and a half to treat this patient, to analyze the patient. So we have time, we can share together, and we have many things to say and to do. So I just want to raise, okay, like that you can sit, come. It's okay for you?
Yes.
Okay, very good. Can we remove the EMLA cream?
Yes.
I have asked my assistant to put EMLA cream on the face. It's always better, for a workshop, because it can be a little bit, stressful for the patient. And the most important is the patient. So now, no, for speaking, I can't, but I take the gloves. Yes, gloves. Thank you. Thank you. So our patient is a 52-year-old lady. 42, sorry. She's a 42, and I saw her just before the workshop, so I don't know her. We are at the same level together. I have just asked her if she had a medical history, specific medical history. She told me that she has a problem on the thyroid, but it's not immune disease, so it's okay. She had, do you have a previous injection on your face?
4 years.
4 years ago, she had previous injection. Where on your face?
Lips.
Where?
Lips, nose, chin.
Cheekbone. Okay, so good to know. And it was hyaluronic acid. It was hyaluronic acid?
Yes.
Yes. Okay. So it's important to ask, which product, which kind of areas were treated. And please, do you have other treatment?
No.
Nothing.
No.
No laser? peelings?
No.
Okay. So I think what we can see on the patient, this is, yes. What we can see when we see the patient now, I have asked the patient to come with a picture of her. It was how long before?
10 years ago.
10 years ago. So what can we observe? Of course, she was smiling at this time, and now she loses the smile. But it is very interesting because we can see the volume. Okay, thank you. We can see the volume on her face. It's totally different. And where does she lose volume mostly? I don't know if somebody can say which area is the most visible. The mid-face. Mid-face. Of course, we can see, even if she smiles, we can see the mid-face is losing the fat. But not only the mid-face, the temples, you see, the temples are, you know, very flat and concave. But she has a very strong, you know, frontal bone. So it's interesting because we don't have to inject the forehead. Only botulinum toxin can be effective in that case. And we can try to give to her a better, you know, aspect, just natural, but better, with fillers and the skin quality texture. So it's what we will do today, just to give her a better aspect, like if she slept 2 nights, no, not 2 nights, but 72 hours. And I think that now it's interesting to see the patient with different lights. Like that, we have to focus on the problems. So, do you have an iPhone? Somebody has an iPhone? Thank you. I need the light of your iPhone. Yeah. I will change my gloves after, but just to see. If I do this, you can observe that the patient is okay. No problem. She doesn't change so much. She has a beautiful face with not so much depression, you see. It's very interesting to see that, because when we are in our office and when we do the picture before that you keep in your file, we have to consider that it's very important to see the problem in the first picture that you have during the story of your treatment with your patient. Because if the patient you know, complained about the result, you can show her, but you see, there was depression here, depression here. If you do the picture with the maximum of light, it's not possible to prove that you have an effect on the face. Now, if we put the light in just upper the patient, I don't see on the screen, but I do that. We can see the shadow on the mid-face. We can see the, you know, the tear trough very deep. We can see the depression on the myonid line area. You see here in lateral condition. So if we observe the patient with the light laterally, it's not the same than when we observe the patient with the light frontally. So just this to show you that it's very different with the light. I can do a before and after picture only with the light, but it's not what we want. So now you have the good light on the screen, and we can see what we can do to enhance this face. So, you know the concept of domino effect and medical lifting. The domino effect, the concept is coming from Filmed company. We will use the Filmed product today to inject this patient. Why? Because I think it's the best indication to inject volume at first, just to restore the aging process and to improve the skin quality. So what is the domino effect? It's very simple. It's when we are injecting one part of the face, we are lifting the part just adjacent to the area you have treated. Why? Because this patient is 42-year-old, and my theory on this, it's because you know that the face is compartmented with fat, you know, of course. And for example, when you are injecting the temples, you will inject into the same compartment that is the temporal lateral fat compartment, which is coming from the temple to the mandibular area. You see here the temporal crest here. We do a drawing which show you where is the temporal lateral fat compartment here. So if I inject this patient into the temple, I will have an effect in the adjacent compartment here, on all the compartments here. So I will have an effect on the lower face, on the mid face, but I will have an effect too on the lateral souffle and on the lateral orbital fat compartment. So of course, it's exactly the same for all compartments on the face. So for that, we will inject at first the upper face, I mean the temples. It will help to raise the tail of the eyebrow of our patient. It will help to open the eye. We will inject after the mid face, and what is now the trend, and mainly in Europe, but you have the same, that we inject laterally and not too much in the center of the face. So I will inject a little bit the cheekbones, of course, because she needs improvement of volume, but I will inject laterally the supraauricular lifting technique. Okay. And after that, I propose to see the result, but to consider the treatment of the perioral area with the lips and the nasolabial fold and the commissure of the lips, okay, the marionette line. So the analyze is interesting when we see the light. We have to see our patient in a sitting position and not lay down, because we can see the sagging. But other question is that you need to observe your patient speaking with you, talking, just to see if there is an asymmetry when she's speaking from the muscle. So for example, can you speak in Spanish, of course, for everyone? And can you explain what are you expecting from this treatment? Are you worried about something? Can you tell us?
¿Qué espero? Pues sí, obviamente pues a los 42, ya obviamente los cambios de peso y la edad, pues obviamente ya la piel se te va haciendo como más caídita. Entonces pues sí, a lo mejor como no verme de 20, pero pues sí de unos 38.
Okay, I will try.
Okay, y no estoy preocupada por nada, todo tranquilo. Nada más sí un poco los labios, sé que duele, pero está bien.
Okay, so with the patient speaking, it's very important during your interview with the patient at first. After that, you can ask your patient to smile. You see that when she smiles, she has very good teeth, no problem with asymmetry on the dental position. It's important. And can you do a kiss and stay like that? Okay, she had emeryl cream, so it's hard. So you see, she has the process of aging is the beginning around the lips, because we can see, you know, the loss of volume around the lips, and we will restore this during the workshop. Okay, it's great. Now let's go to the profile. I need this. This is a good tool just to analyze the profile. You know the Ricket line. So if I ask the patient to stay in profile, or the camera can go in to show a profile, probably the profile of the patient. Okay. Thank you. So we have, yes?
Which profile do you need?
It's not a problem, which, only the profile. So we have this line, very interesting. It's the Ricket line. The Ricket line is coming from, you know, dentist, orthodontist, which show you the position of the lips when we want to be artistic, you know? And we have just to put the line in the tip of the nose to the pogonium of the chin, you know, the tip of the nose and the pogonium. And usually the lips should be few millimeter behind the line. So it's like 2 millimeters for the upper lip and 3 millimeters or 4 millimeters for the, no, it's the opposite. Less millimeter in the upper. So 2 millimeters on the lower lip and 4 millimeters or 3 millimeters on the upper. So for that, usually I say it's, you know, a criteria of beauty, but you don't have to reach always this kind of artistic criteria, because sometimes, you know, the lips should go very, very far away from the line, and you agree with that. You prefer to stay natural.
Yes.
Like, I think 90% of my patients. I don't know for you, but usually we have patients, except of millennials, we have patients who want to keep the natural. Okay, so I propose to begin the injection by the temples, after the mid-face, after we will focus on the perioral area, and at the end we will improve the skin quality with NCTF and fine lines from Filmed. The volume will be injected with the Artfiller volume, and I will use the 23 gauge cannula with 5 centimeter. And for the lips contour, I will use the 25-50. And for the you know, Bio-Nutri-Lift protocol, I will use the 25-60 millimeter. Okay, so now you can probably go a little bit
Okay.
like that your head is well positioned, like that. Are you okay? It's important that you are comfortable. It's okay?
Yeah.
Okay, very good. So now I just put the back like that. Great. And I just raise the bed. This is very important to have a good position, your patient and you, because if you are not well positioned, the injection is always not good. Okay, so we will remove the drawing.
Okay.
Okay, we remove the drawing, and she has a thick skin, so it's very interesting when we are injecting the temples, because we can use the subdermal layer with volume, with Artfiller volume. You will see that it's very regular with the Artfiller volume, because it's a very adapted product to the temples, I think, because it permitted the, you know, the good distribution of product. So I show you how to inject the volume with the temple. So now I prepare. So here you have the syringe, of course. It's very important to tell you something. Do you have the box?
Yeah.
You know, usually when you open the box of your filler, you have inside take the package, you have this box. And some doctors are believing that inside it's sterile. But you have to know that it's not sterile. In all brands, because in the manufacturer, the syringe are sterile, but at the moment they put it in this box, it's not sterile. So don't use it to put your cannulas or your needles, okay? So now what I do, I take some gauzes, I put the sterile gauzes here, and I use it for, so please, you can do it. I have, you know, insert the cannula into the syringe. I use the forceps just to pinch the cannula to the syringe. Very important. More. And I will, of course, show you the injection with the easy guide. So this, like that, I can put this. Okay, easy guide, it's the Preol needle that I showed you before, okay? And I use a 23 gauge cannula. So just 1 point on this cannula. Don't be afraid by the caliber. I see a lot of doctors who are afraid because it's large. They are, you know, worried about being painful or traumatic. It's the opposite. If you use a large cannula, you will be very safe and no painful. If you use a very thin cannula, you can be painful. So please, disinfection. At the moment, on the gauzes. Okay? So at the moment you will do the disinfection to the patient, you have to wait 3 minutes. If you disinfect the patient and immediately inject, you have not the effect of the liquid. You need to wait 3 minutes. Okay, thank you. So I do the disinfection. Again and again, always you have to do the disinfection of your patient, prepare others. And you see, I do the disinfection on the whole face because the cannula is always, you know, touching all areas on the face. So you have not to do the disinfection only on the temples, but everywhere. I use chlorhexidine. Okay. Now I would like xylocaine, please. I just show you with the xylocaine. This is the syringe. You have to use a very small syringe, you know, the 1 ml syringe, and just 1 drop at the insertion point. It's always better to be comfortable for the patient. And as I told you, the most important is the patient. Thank you. You can prepare others now. Okay? 4. Okay, so the entry point. How we decide to do the entry point. As I will inject 2 areas, the temple and the mid-face, I usually use 1 entry point for both. The best entry point is the superior border of the zygomatic arch. I'm exactly on the area and I inject the xylocaine just at this point. 1 centimeter from the hairline, exactly located on the superior border of the zygomatic arch. And after that, I can begin my injection. So put the cannula always on different, okay? So now I insert the easy guide in the direction where I want to inject. So if, for example, I want to inject the temples, I will not go in this direction because it will not be possible to follow this direction. So I put the same direction that I want to go. Are you okay? Yes? Good. And you see, I just slide on the easy guide. I move the cannula and I remove the easy guide. After that, I just push the cannula. And my goal now, can you turn slowly? Thank you. Is to be on the superficial fat, just the layer 2 of the temple. Why? Because I want to control my injection. I know that you can't see anything, but I have just to prepare, you know, the way for the cannula to go. Here, you see the level of injection. It's very superficial. And as she has a very thick skin with very good product like the Artfiller volume, I can, you know, inject in this area. But we have 6 different ways to inject the temples. Of course, I can be interfacial. I can be very deep on the periosteum. We can have different, you know, technique to inject. This technique is subdermal. So I inject slowly the product. You know, the speed of injection is a criteria of safety. If you are very fast when you are injecting, you can be dangerous in terms of, you know, vascular occlusion. Now I inject just near the eyebrow, but I want to avoid the migration to the eyelid. So I take in consideration the red dot. I want the red dot to be in the left side in order to move the product to the temples, but not to the periorbital region. I inject the product, and I'm sure that some doctors are thinking, oh my God, it's irregular. So you will see after what I will do to be very homogeneous and to have a perfect result. Now I continue. I inject with the retrograde technique with a fine shape. Yes, the ball is good. Yeah. So I continue to inject. You see the, you know, the direction of the product. So usually I use 4 different injection, retrograde injection on the temples, and I use 2 boluses. I will tell you after how I do it. You see here the last one. I have 4 small injection. Usually I use 0.1 for each, and after I keep the product to do 2 boluses into the hairline. So I move the cannula here to another direction, perpendicular or parallel, if you prefer, to the zygomatic arch. And I go after the hairline. I push the cannula. Normally it's not painful, so we have to be very gentle, okay? And I do, you know, lifting with my cannula, you see here, and I push the product to have a small bolus. My quantity injected is 0.2 ml, and I have to be very gentle when I inject. The first bolus was done, and now I do another 1 centimeter up to this one. Karen, after we have to just arrange the hair. You understand? Okay. The other bolus here into the hairline. Nobody can see. It's very natural, and the effect is very effective on the eyebrow. Now I remove slowly the cannula, and it's done. Now to have the good result on the homogeneity, you can move the product up. You do a massage, and you move the product in different direction, like that. You see it's much better. And if you want to have a perfect result, you can move the product down to the entry point and removing the product in excess. As you see here, we have a small quantity of product who is going out. Like that, we avoid totally the irregularity and product in excess. Good. So now, 1 second to change my gloves, and Karen will help me to arrange the hair. I will inject now the mid-face. The mid-face is very interesting because it is the key point of the face, the most important third that we can see immediately when we have a look on somebody. One very interesting publication of my friend Sebastian Cotofana is down about the supraauricular technique. When we are injecting on the supraauricular region, we can have a very good lifting effect of the mid-face, include the nasolabial fold. So I think we will see it on this patient, but before I will inject the cheekbone and after the supraauricular region. Thank you. Okay, so after you prepare the other one, okay? Okay, so I keep the entry point. Thank you. Another disinfection. I keep the same entry point, and I want to improve the cheekbone. So to improve the cheekbone, I have to draw, give me this one, just the limit of the cheekbone. This one, does it work? Okay, give me this one. Okay, so the limit of the cheekbone, usually I draw a triangle between the entry point here, I mean the superior border of the zygomatic arch, to the nasolabial angle, like that. Another point, another line coming from the same entry point to the commissure of the lips. And you share this triangle in two parts, like that, and you have to inject mostly in this area. Okay? So I do now the injection with the Artfiller volume with the same entry point in the deep layer of the mid-face. I will try to be on the periosteum, okay? So I insert the cannula perpendicularly to the skin. I have inserted my first easy guide in this direction, so I follow the direction, and with the fat, the superficial fat, I will move the cannula okay, to the mid face. I'm now in the good area. I move the cannula which follow the direction of the cheekbone. I raise all the anatomical structure in order to be deep and the deepest that I can. And I feel the bone now. And I have to show you something. Look at my position. I am behind the patient. This is important. I have to show you something. When I raise the cannula, it is maintained by the muscle, the ligament. Usually, of course, the ligament concerned by this injection is the zygomatic ligament. And I want to inject a small quantity of product behind the zygomatic ligament in order to create the lifting, because ligaments are pulling the skin up. Okay, so now it's okay, and I begin the injection. Red dot should be down in order to be very deep. Are you okay?
Yes.
Okay. In this area, we have the infraorbital nerve, so we need to be careful, of course. And you can protect, if you want, the orbital rim, if you want to be very safe. I inject retrogradely, very, regularly along my drawing. I want to inject the triangle I have drawn before, so I go back in the same layer, and I want to be very respectful of the orbit, so I put the red dot to the left side in order to avoid the migration in the infraorbital region. So I inject now the cheekbone. I want to give a big convexity, not so much, but a good convexity. And when we are injecting temples and cheekbone, what is very important is to conserve the homogeneity between the temple and the cheekbone. I mean the OG curve. OG curve, it's like a S, and we have to conserve the same concavity and convexity. If you have too much concavity into the temple, it's sometimes due to too much convexity on the cheekbone. So if you balance very well the volume, you will be harmonious and artistic. Now I just sculpt the product. She has no much fat under the skin, and I can feel it. So I feel very well the product. It's a good case of feeling. Okay, that's it. So now you can see, no, stay like that. Thank you. Mm-hmm. You can see the difference if we observe the patient in this position. Okay, I have injected, of course, the cheekbone and the temples. So now let me show you the supraauricular injection. I have injected 2 syringes, now the third one. I stop here during the preparation, and I will speak about marketing in our office. So usually in my office, I can tell you that I do a lot of volumization, because I consider that the treatment of the aging process is to go back with volumization. We have to be very natural, but it's important to explain to our patient what is the effect of an injection on the temples, on the cheekbone, behind the hair, etc. So usually I don't sell too much treatment like 1 syringe only. It can be, of course, possible if I inject the lips or the nose, but for volume, usually we need more product. And I explain, you have to explain. All patients are understanding. I say, I don't want to inject your nasolabial fold, because with aging, you will have fat inside, because the fat migrates in the center, of course. And if I put hyaluronic acid, it will, of course, boost the creation of elastin, of course, collagen and hyaluronic acid. So you will have volume, and volume in excess with the fat. So it's not good to do that. I prefer to inject laterally, nobody will see, and it will stretch your face. So they understand. Usually I sell package, and I propose a package of 4 syringes. I think it's very useful sometimes when you have to inject cheekbones and lips or perioral area. You need 4 syringes, 2 and 2. And I sell 6 packages of 6 syringes, because we need usually 3 syringes for the upper and mid face, and three each side, so I mean 6 syringes. And if we have to restore the lower face, we can add other product, but not in the same session. So usually when you go to the dentist, they ask you to come back and to come back and to come back. There is always one care to do, you know. At first we have to clean, after we have to, you know that. So we have this philosophy. We know that we can come back for a good treatment. So if you ask your patient to come for the first time, we can inject the temples. That's it. After you come back 15 days or 1 month after, you can just have the philosophy or the psychology to understand your patient in front of you. If they don't have so much money or they're afraid about the quantity, you can say, come in 1 month, I will do the cheekbones, and come back 10 days or 15 days, I don't know, after to do the lower face. But they will be in confidence with you, and they will expense their money, but slowly by slowly, you know. And it's better, because if you say, oh my God, you need everything, it will cost 5,000 euros. So people will be, of course, afraid and leave and will never come back. Like, I'm sorry, when I ask my patient to have an advice on a surgery, in clinic of surgery, sometimes they come back to see me and they say, oh my God, I wanted only eyelid surgery, and they ask me to do the neck, the face, so they will not do anything. So it's better to ask them to do slowly by slowly. Okay, so now we have the syringe, and I will show you the supraauricular injection. So turn a little bit like that. Yes, thank you. The supraauricular region is exactly located just upper the tragus. So sometimes we can inject the tragus, sometimes we can inject just above the helix. It's what I will do now. So I push the cannula into my entry point, the first one. I move the cannula externally in order to go behind the hairline and just upper the helix, the top of the helix. I push my cannula and I will inject I will inject half a syringe in this place, which is very interesting because, as I told you, we have a lifting effect and nobody can see, and it's not painful, so it's really the good injection to do when you want to improve the mid-face. So I do a bolus, but I have to go very slowly. I have injected 0.3 ml, and I want now to go to the tragus. I can inject with my both hand, so it's not the case of everybody. So I just show you with only one. You push until the tragus here, you see, and you can inject 0.2 ml of product just in this area without pain, without bleeding. Can you stay like that? Okay. So at this moment, I will ask the patient to sit up just to show you the difference. Thank you. Okay, stay like that. We will try to have the good light. Okay, so you can see obviously the difference between this side injected and this side not injected. And what I love in this treatment is that I have not injected the dark circle or the infraorbital region, only, you know, cheekbone and lateral part of her face. So do you have a mirror? At this time, you can show to your patient the difference. They will be in confidence with you. and they will see that it's
Okay.
better, of course, and natural. This is the most important. Okay? Thank you. Now, something very important. Look in front of you and smile. You see, the smile is not changing, but what we can observe, it's the nasolabial fold. You see the effect on the nasolabial fold. It's less heavy, and we have very good result on the mid face without increasing too much the volume. Okay? Thank you. So now we'll do the other side, exactly with the same technique. Okay. So I need disinfection. So we will do the disinfection. I change my gloves. Thank you. Yes, the same. No, I will take the full one. Yes. The plane is superficial. I am just on the superficial fat. Yes. No, in the for the tragus, I was injecting in the superficial fat, and for the supraauricular region, it's the same superficial fat. Yeah, and sometimes you have patients who have a lot of depression there, here in this area, and you will see that you can inject a lot of product, but it's enough to create the lifting. So you don't have to inject too much in the cheekbone. It only the lateral region, it's enough. You understand? So now the anesthesia, disinfection, okay. Like that, thank you.
Doctor,
Yes?
in all the areas last filament volume or to change the...
So usually for cheekbones and temples, I use filmed volume. But I know that some doctors love to use the universal in the temple. You can, but you will, it requires more product to have the same effect. So if you do the same technique than I made, you can remove the product by the pre-hole. You will see, you will not remove a lot. Sometimes it's like 0.05, you know, but you will have a perfect result. You can do it. Thank you. So I repeat the upper border of the zygomatic arch here, 1 centimeter from the hairline. I am exactly in the good entry point. And I inject 0.02 ml of xylocaine here. Thank you. I will do during this time just the drawing of the cheekbone. This. This is the, I'm sorry. No, I was a little bit lower. I need just to remove the, I'm sorry. I was a little bit lower. Like that. Thank you. Okay, I share the triangle in 2 equal parts, and I will inject in this first triangle. Okay. For men, of course, it's not the same characteristics, so it's not the same drawing. It's not. One day we will do a workshop with the men. So now the easy guide into the entry point, but I will inject at first the temple. So I introduce the easy guide, not so deeply. Thank you. I move the cannula into the easy guide. I just try to show you without my hand. I remove the easy guide and I am in the good level. Okay. When I want to be superficial, I help my gesture with my left hand to pull the skin in order to push easier, you know, the cannula. And I am in the superficial, on the superficial fat. You see here the layer of injection. I inject with precaution, you know, for the orbital rim to avoid the migration. I do 4 injection, retrograde injection. 1, 2. This is the second one. Okay. You see here I'm just above the superficial fascia. After I continue the injection, I am injecting the 3rd retrograde injection in the temple. And for the 4th time, I am doing the injection of the last retrograde injection here. And you see, I took my syringes like that to push easier. Okay, now I inject. I do 2 boluses. The first one is perpendicular, parallel to the orbital rim, to the zygomatic arch. Here, I do 1 bolus, injecting very slowly. And the second one is 1 centimeter upper. Into the hairline, and I have to stretch the skin like that. You see. Okay. Now I remove slowly the cannula. We can prepare another one. And I do the massage to homogenize, to have a better homogenization. And if I want perfect result, I have to go in the other side to remove the product in excess, like here. You see? Here we see very well the product. The gel is really perfect because there is no vascular effraction. Sometimes when we remove, we have red. The gel is red because you can have a small effraction of the veins. Okay. Now I will inject the cheekbone with another syringe with the same entry point. Of course, in the another direction, so I move the cannula like that. I want to be deep, so I raise all the fat and the muscles. I follow a very deep way, and I raise here. I have to be very gentle because there is the infraorbital nerve. Be careful with the compression if you inject too much. And I am injecting. I want to preserve the orbital rim. So I am very careful with this. The red dot should be in the other side. I go back. I feel the bone. I hear the sound of the cannula on the bone. And this is a good indication for injecting the tear trough. Sometimes you have only to inject the malar area or the zygomatic area. This mandibular ligament that you across, you feel a resistance. Okay, the cheekbone is injected. Now I have to go back behind the hairline for the effect of lifting. Don't forget to sculpt the product always. Okay. We can see very well, you know, the convexity of the cheekbone. And now I inject behind, so the same entry point. Thank you. Okay. And you go back with the cannula in a superficial layer, like I showed you before. You see just upper the helix in the supraauricular region. I do a bolus of almost half a syringe, but I inject very slowly. Okay, probably I can go there. You can see better the injection. Yeah. This bolus is really effective on the lifting. Are you okay?
Yes.
Good. You see, it's not painful. It's okay. Another one on the tragal area. So I move the cannula a little bit in another direction. Here you can see, and I think that you will see exactly the product injected. You see a very good movement that you can have. It's to take the skin and to reach the cannula with the skin. You understand? Like we do threads. This is interesting for having a better, you know, way on the cannula. Okay, that's it. Stay like that. Okay, I will just sculpt the cheekbone. If you want, you can move the product a little bit up. Okay.
How do you manage these kind of patients with a very skinny face and they have very terminal bones? You do the same technique or you add more bone?
No, usually I don't do the same thing. I repeat the question. How I manage the patient who have very projected bones. So usually I don't inject on the bone, on the malar area. I inject mainly, you know, on the maxillar bone, but not on the malar bone. Okay, so the entry point is not usually located in the same area because it's hard to follow the convexity of the projected bone. So usually I put my entry point in the middle of the jaw and I come easier from this entry point. Okay? Okay, so now you can sit up and we can see the patient laterally in a 3/3 position. You see it's totally better. And we have an effect on the lower face, of course. Now I propose you to go to the lower face, okay? Because we have a big program. We have to inject after the skin texture. So let's lay down. I need universal with a 25/50 and easy guide. And during this time, I do my anesthesia. So I use xylocaine. I would like to show you my technique for marionette line. I hope you will love it because it's perfect. You will see the efficiency of this technique with minimum of product. Okay, so for injecting the perioral area, I use one entry point located at the commissure of the lips. If I want to inject only the lips, I take my entry point few millimeters from the commissure. If I want to inject the marionette line and the nasolabial fold, I will be a little bit far away from the commissure, but I have to take care of the modulus. When I put my entry point, the modulus is 2 centimeters from the commissure. So usually I go in the middle, I think 1 centimeter from the commissure. I do a small drop of xylocaine here. Okay. I use the easy guide and the universal. Universal is less viscous than Artfiller volume. It can be injected everywhere on the face, as its name, universal. And you can, I love to use it on the lips because I think it's very natural, you know, not too much inflammation. You can use it for the contour, for the volume, for nasolabial fold and marionette line. If the nasolabial fold is deeper, you can use volume, of course, but for this indication, it's okay. So now I use the easy guide very superficially. Look, I don't insert the total tube, needle. Thank you. I put the cannula sliding on the easy guide, and I penetrate the skin. Slowly. Okay, I'm inside. I have to go slowly. And I begin by the nasolabial fold. So usually in this case, of course, always I try to be inside the triangle. Look at my level of injection. It's very superficial. And the red dot here is very important because if I inject like that, I should have a migration in the jaw. So I prefer to inject in this direction or up. Okay, so now let me inject. It's a little bit painful for that, I'm sorry. It's okay? Mm-hmm. Okay. And if you are in this level with a cannula, you are really safe. You have not to worry about the facial artery. Okay. I have injected the nasolabial fold, but very gently, without too much product. And I use a very fluid product. Like I told you, with aging, it's not good to put too much product in this area. Now I will inject, the lips. So I show you after how I manage the pain. So I prefer to inject the vermilion at first, the upper vermilion, because it will diffuse a little bit the lidocaine on the vermilion border, because the vermilion border is very painful. So the vermilion, so you know, I don't know if you need a reminder of anatomy. I need to be very superficial if I want to take care of the superior labial artery. The superior labial artery runs deep into the lip on the limit between the wet lip and the dry lip. I mean just in this area, but very deeply. Here you see I am very superficial, and I will inject a small quantity of product because she wants to be natural. So usually I inject not more than 0.2 or 3 ml on the vermilion for this indication. It's important to do the massage just immediately after, because you will have the perfect volume after the massage. Okay, that's it. Now, sorry for that, I will inject the vermilion border. So for having a very precise injection like a needle, you have to move the cannula up. You see the tip of the cannula, it's like a very white ball. You see here the white ball. So we have to be in the virtual canal. So we have to move the cannula precisely, superficially into the vermilion border. And here I am exactly in the good level. I increase the volume of the Cupid bow. I inject the base of the filtered crest here. And if you want to have a Russian lip, for example, you have to put a lot of product in this border, this contour, and you will have good result. Now I have finished with the contour, okay? If we show to the patient now the results, she will cry. But we have to harmonize with the lower lip, and it will be better, and she will not see the volume we give, okay? So I take the same entry point. Okay. I put the cannula into my first entry point. If it doesn't enter, yes, it's okay. And I move to the lower lip. So we have to be careful here because we can bruise. And we have to go slowly. Okay. I go into the vermilion border. Not border, into the vermilion of the lower lip. Can you open the mouth a little bit? Thank you. I ask the patient to open the mouth just because I want her to relax the contraction of the mandibula. Because sometimes they are very contracted and it's impossible to go inside. So, okay, I inject the lower lip superficially in order to avoid crossing the inferior labial artery. And I'm okay. And you have to stop a few millimeters from the commissure to have a good aspect of the lower lip. You can close your lips. Okay. Now we have a beautiful harmony. And I want to show you this technique for the marionette line. So you have to be perpendicular to the marionette line, perpendicular, very superficial. Look, I'm really very superficial to the marionette line. Okay, you see here the cannula, and I have to increase the fold, the pre-jewel sulcus. You see, I increase the fold and I verticalize the cannula like that. And I am injecting, the product during the time I'm pulling the cannula to me. You see, this technique usually require minimum of quantity of product. I have to do 2 times. The first time I show you, I did it. Now I show you the second step of this technique. You continue that, and you go until the commissure of the lip. The red dot should be up. Yes, thank you. So go slowly, inject not too much product. And pull the product, the cannula, when you are injecting the product. And with the same process than I did on the temple, you have to remove the product in excess if you have injected too much. So of course you know that we have a small inflammation just immediately after the injection on the lips, and it's normal. She will recover, I think, tomorrow or in maximum 2 days, the good level of her lips, the good volume. Okay, so just to see the difference, can you sit up? You see the proportions are perfect and the marionette line is raised. The commissure is exactly raised as we want. She smiles and she, in the other side, the commissure goes down. Can you smile? Now the smile is a little bit asymmetric due to the anesthesia. Okay? Okay. The other side. Are you okay? Okay. So we do exactly the same. Take the table here. Yes. Yes, 25 gauge, 5 centimeter. Okay, exactly the same. So I do my entry point, just disinfection. My entry point, few millimeters, I think 1 centimeter from the commissure. Thank you. One centimeter, I inject the xylocaine, a small drop. So with epinephrine, it's better. Like that, you don't have blood. After I insert the easy guide, are you ready? Okay. So I insert the easy guide superficially, like that. Thank you. And the cannula is inside. I move the cannula to the nasolabial fold. Like that, very superficially. And I consider the issue of the product with the landmark on the end basis, okay? So here I have to be inside. I do my injection, retrograde. Okay, the nasolabial fold is filled. Just a little bit more. Okay. After that, I inject the vermilion of the upper lip with a very superficial injection. Like this. Open a little bit the mouth, thank you. And I do the injection. I try to put exactly the same quantity. It was 0.2. Okay. It's perfect. Now I inject the vermilion border. Sorry for that. So I have to put my cannula up to reach the virtual canal. And I follow this white small ball that I have created with the tip of my cannula. I go until the cupid bow and the filtral crest, and I inject small quantity of product, okay? Now I inject the lower lip superficially in the superficial submucosa plan. Sorry. Okay, I inject the same quantity. I have injected 0.1 ml in the other. Okay, and I stop just before the commissure. Can you close? Thank you. So, by experience, with my experience, I know that the upper lip is always more visible than the lower immediately after the injection, because the injection of the vermilion border is really create inflammation. So don't worry about the disproportion. It will be totally corrected by with the time. In 2 days it will be okay. Now I do the marionette line correction. So as I told you, I go perpendicular to the line, like that. I am very superficial. Okay, you see. I create the fold and I go vertically, injecting all along the injection. You see? And the second one is close to the commissure. So I continue. Like this. Okay, the commissure is totally corrected now. And I have finished the syringe. So 2 syringes for all the area. You have just to massage the lips, upper and lower. You can put little cream, the balm, yeah. Thank you. We do like on Instagram, you know, the gloss effect. Okay. You can see it. Okay. Natural result. Of course, she has volume, but it's required because she will lose around 15% of her volume. You want to see?
Yes.
Are you ready? Okay. So I would like somebody can just project the picture before. Do you have the picture before or not? Not when she was young, but just before the injection. You have it? You like it?
Yes.
Great.
Thank you very much.
Okay, if we can see the picture before, it can be interesting. And now I propose you to treat the skin texture to finish. So for that, I will remind you some bases of anatomy, just because it's a moment to show you this, and we will use the fine lines and the NCTF. So I need fine lines. Oh, okay, you prepared it. NCTF and fine lines. Okay. So during this time, I show you. I need gloves. Okay. So you see the patient. Can you do something magic with the picture before? We can see her in the screen here. Look here, and you can see her just before the injection. You see the effect on the infraorbital area. You can see the effect on the lips, of course, on the temples, and on the lower face. The face is smaller, you know. She had a long face, but now we find again the facial triangle. Okay, this is good. So now I just show them the skin texture treatment. No, I will ask you to sit up again. I'm sorry. I forgot.
Do you want to use
So just with a 2560. Yes, just to show you.
do you want to
Yes.
use all of the vial?
Yes.
Okay.
You share. No, you put everything inside, and I will do it. Just a small reminder of anatomy. You know that when this is the basis, but you need to know that and to train to the other doctor. So can you contract the mandibula? Not like that. Contract a little bit, not too much. Okay. When the patient is contracting the mandibula, we feel better the masseter. The masseter is, I feel it, is exactly here. And the anterior border of the masseter is located where my finger is positioned. Relax. Okay. So what's happened here in anatomy, the facial vein is coming just close to the anterior border of the masseter. You have to know that. And this facial vein is running up like this, following this direction, going to the nose, and it comes the angular vein. Okay, facial vein like that. The facial artery is inside, around 1.5 centimeters from the facial vein. Of course, it comes from the carotid and runs parallel to the facial vein. It divides in two arteries, the superior labial and inferior labial, and becomes the angular artery, like that. Okay, So what is important? Usually, I draw a line which is just near, take this, which is coming from the medial canthus to this anterior border of the masseter. So this line. And the name of this line for me is the line of safety. If we inject inside this line, we can be dangerous, we can have danger. If we inject outside this line, it's relatively safe. There is no problem to inject. So you have to know that to train doctors with this basis of anatomy. It's important to know that, okay? And as I told you, the labial arteries are coming inside deeply. So why I explained that now, because I usually use a single entry point for each side when I'm using the NCTF and the fine lines for the skin texture. And my entry point is located 5 millimeters below the safety line. Usually it's here, okay? It's not, you know, a rigorous location because of course the anatomy change with individuals, but you have some landmarks and you can imagine that your entry point should be here. And if my entry point is here, and of course I will be very superficial because I want to enhance the skin quality, I don't have problems with the vein and everything. So I just want to avoid the hematomas when I introduce the entry point. Okay, thank you. You can. So I will begin by this side. During this time, you can remove the makeup. Okay? So, contract the mandibular. No, a little bit. Okay. Okay. So my entry point should be here. I use usually a cannula with 6 centimeter length. It's easier, you know why? Because I want to go everywhere with my cannula, include the white lip. So I inject the white lip with the fine lines at first for a good subcision, because sometimes we need to have a subcision just below the wrinkles and block the septi, you know, and of course to increase the skin quality. And I want to go below, under the lower lip and everywhere, so I will move the cannula around the entry point. So I just put a small drop of xylocaine. And I will do the sandwich technique with the fine line and the NCTF. So at first I use the fine line. So you can turn a little bit like that. I need the injection. Okay. So, as I told you, the vessels are here, so I go externally. It's better for bruising. For avoid the bruising, I insert the cannula and I will be very superficial. My goal is to have a better, you know, hydration, a better, to boost the fibroblasts. So I will do a lot of small injection retrograde around my entry point. Of course, you have to avoid the infraorbital area. You can inject the infraorbital area with the NCTF, but try to avoid with the fine line, because it's a little bit cross-linked. Okay. Now look why I use a long cannula, because I want to travel the nasolabial fold and to go until the white lip. Like this. You see, it's very homogeneous. Something like that you can't have it with a needle, of course. And of course, the diffusion of the product goes around 1 centimeter from the different lines. So we cover all the skin surface with this kind of injection. We didn't talk about the forehead, but it's possible to inject the fine lines on the forehead, you know, to treat a little bit the wrinkle on the frontalis, and of course to give hydration. Okay, so now I'll use the NCTF. It's better to do this in this, how do you say, in this step. First step, the fine lines. Second step, the NCTF, because the fine line prepare to the anesthesia, of course, and it's better to put the no reticulate product on the reticulate one. Okay, thank you. Last injection in this side. So now my goal here is to improve the skin quality. I will, of course, boost the fibroblast, but I will give vitamins to the skin and hydration with HA, but no reticulate HA. I will be preventive with the anti-radicals, free radicals, and we have inside amino acid, which are very useful for the firmness of the skin. Okay. Of course, you can inject with the needle, but when you are doing the BioNutriLift, it's best is with the cannula. And like that, you are not traumatic, you go everywhere. Okay, now I share the syringe. I keep the other for the other side. At the end, you have to just distribute the product, so you can do like a, you know, a very superficial massage. It's very hard to see with our eye the improvement of the skin quality, but I'm sure that the patient will see it. Can you just sit up? I remember that I have treated the left side of the patient for the skin quality with fine lines and NCTF. Can you have more light on the patient? Probably just to see the skin texture. Yes, perhaps. Yes, you see it. You see that it's, you know, more nourished. It's okay. It's very good. Smile now. You see when she smiles, the elastosis visible here and the good quality of the skin here. Okay, you can lay down and we do the other side. And after we will finish. So, half a syringe, okay? And the other half in the other side. So my entry point is here. Okay. This, you give me the syringe. So this is now the fine lines. I remind you to insert the cannula in the mid face, but in the upper direction. Okay. I move the cannula to the superficial fat, the layer 2. I inject with a retrograde technique and fan shape all around the entry point. You see the superficial layer. So now the interest of this cannula is that we can go into the white lip very superficially. Like this. And we move all around the entry point. Look at the level of injection, always regular. Now I inject the NCTF. Okay. Okay. Do another one. Can I have a gaze? Ah, I have one here. Okay. It's okay. It's almost finished. Thank you. So now the 6 centimeter length cannula for injecting the NCTF. Okay. And you can approach a little bit, you can go closer the infraorbital area. with this product.
So do you think NCTF works better intradermal or subcutaneous?
So I think it diffuse. So I think you can use both technique. You can use the intradermal with the needle, with the nanosoft, for example, and you can use the subcutaneous with the cannula. But my opinion is that the product diffuse. So you see here we have a perfect example of what we can do with fillers to treat the volume, to improve the skin quality, and we can do that in one session. We can, of course, have the minimum of trauma and very natural result with the cannulas. Sorry, I tried to do my best with the jet lag and and 2 heavy days of work, but it was okay. And my challenge was to avoid the bruising for the patient, because I love to respect my patient, and it's okay. She will go working tomorrow very quietly. Okay, so now you can sit up. I will, yeah. Do we have the picture before? Okay. We will just check the picture of the patient before. It was very good. It was a Quantificare, you see, 3D picture. Look at the mother and the daughter. It's exactly that. So, just to conclude, I have treated this patient in many dimensions. You saw the bone level for, you know, improving the structure of the bone with the volume on the temples and the cheekbones. I have injected the fat, the deep fat and the superficial fat in the perioral region. I have injected the subdermal layer with the Filmed 5 lines product and the NCTF in the maximum of superficial layer that I can reach with the cannula. So it was many dimension with 2 insertion points for fillers, the zygomatic point and the point at the commissure of the lips. And for the improvement of the skin, I used the entry point located in the middle of the jaw, as you can see here. So minimum of trauma, minimum of pain, and maximum of comfort and very natural result. So thank you for your attention. Thank you. And now time for question.
Commander is coming for the question.
Yes. So if you have question, I'm here.
And
Microphone? You have? Emmanuel. Emmanuel, you have a look. Have a look on the patient before. And please, can you focus on the screen? Yes. And this is the patient after. Can we have another picture? You know, the 2D picture that we had before.
Yes.
The 2D.
We will make this in a few minutes. We're taking picture now of the patient outside.
Yes,
And
yes. You will
hopefully
see.
we have it by the end of the questions. If we can bring the patient outside. Muchas gracias, doctora. Il y a plusieurs questions, je vais te traduire.
Ouais.
Pasamos a las preguntas. Muchas preguntas. Le hago la pregunta en francés y en inglés sobre topilase. When you apply topilase to the patient that comes back to her home, which product additional to topilase you have her get home? Is there an additional product you want to?
So usually you can ask if the patient apply topilase in our office, it's better. It's not a good idea to give the valve to the patient to apply because it's a cosmetic, so you can say, take the product. It's not a good idea because the patient can do, anything with it and you could have problem. I propose to say to the patient to not touch, and if they want, they can use, hydration cream. That's it, moisturizer. That's it.
Good.
Nothing else.
Still with topilase,
Because
how long do you wait between one session and the other? Or is it on observation based, or is it based on a certain protocol?
So I told you during the workshop, the effect of topilase is around 7 days. And I think it's precise, it's 7 days. So you can wait 10 days to be sure. And after you can continue your session if you want, or stop and re-inject the patient.
Good. In terms of FilmMed protocols for men, do you have a different approach in terms of products, viscosity, elasticity, rheology choice, and cannulas and or techniques when approaching a man and a woman?
Of course, we have different approach. I propose you to go to find my publication on the stop facial aging method because you have all landmarks and you have the drawing of all boluses that you have to consider. Usually we maximize the volumization on the malar area for men and mandibular area, and don't forget the jawline and the chin. The chin should have 2 protuberance, 2 lateral protuberance instead of 1 for women, because for women we have a usually pointed chin, but for men 2 are required.
Okay.
And we use, of course, for this because it's bone structure restoration, so we need volume, so high G prime product.
Good. There are a lot of questions regarding some areas we have in Mexico, like nose, like lips. What is your recommendation in terms of products of FilmMed and cannulas or needles for those areas, specifically nose and lips?
For nose, definitely the best cannula, I speak about my opinion, but opinion of different experts, is the 25. 25 is really very effective for nose. The length of the cannula is 25-50, or you can use 25-40 because you could be more precise with it. You can do your entry point in the middle of the nose or in the tip, on the tip. It depends on what you prefer. I prefer the tip because we avoid hematomas and it's easier after to reach the columella. And if you inject the columella, the tip of the nose, you have this perfect cannula, 26 gauge, 13 millimeter. You can inject from the columella to the tip and into the columella. So 2 cannulas, 25-50, 25-40, and the third cannula you can use for the tip is 26-13.
Now we've seen today 100% focus on face. As you know, Softil is also doing some cannulas of certain gouges that plastic surgeons use, and you got inspiration from Sidney Coleman. You told us the story. There are some plastic surgeons here and some connected. Which cannula do you recommend, or which cannula should be the best for gluteus filling with hyaluronic acid?
Okay, so if we don't speak about face, we can speak about neck, for example.
Also?
For the neck, the best cannula is 22 gauge, 9 centimeter or 10 centimeter. So you come from the mandibular angle, you do the entry point in the mandibular angle, and you follow different lines with retrograde injection, and it's really effective. You can use universal, you can use Artfiller volume. It depends on the quality of the skin. Don't use volume on thin skin. Sometimes some patients have very thick skin on the face, on the neck, so you can use this volume. But the best cannula is 22. After, we can use, of course, on the décolleté, we can use 22. It's a good cannula. And for body, usually we use 20 for arm or for arm and for
Abdomen.
abdomen. And 20 is good. You can use 18, of course, it's the best for buttock injection. That's it. And you can use 20 for foot. You can use 25, 20 or 23 for hands.
22 or 23?
22 or 23 for hands.
For hands, great. Now there is a lot of other questions, but I would like to give the audience here the pleasure to ask you any question they would have live, and we're gonna get this for the whole audience who is still connected. So, are there any questions, preguntas aquí en la sala? Puede ser en español sin ningún tema. A la doctora, por favor, José.
Is there any specific area that you prefer the needle against the cannula?
Usually, I prefer cannula. You have imagined, but yes, for filtral crest, I think it's not an indication for cannulas. For the drawing of the filtral crest and the cupid bow when you have to do it. And usually for very young patients, the millennials, for lips, I think the needle can be the best way. Because why? Because the mucosa is very firm, and sometimes it's hard to push the cannula inside. It's painful, and it's not a good indication,
Interesting. Gracias, doctor Cortés. Otras preguntas, pasen por sus diplomas a la salida y fotos con la doctora. No se nos vayan, por favor, para que estén. Y si lo quieren disfrutar con un cóctel y una copa juntos. Doctora.
Gracias. Disculpe, ¿la técnica de revitalización con NCTF se puede hacer en la vela?
Yes, I understand. So for forehead, usually you have to put your entry point in the temporal crest, okay? 2 centimeter or 1.5 centimeters is the best from the eyebrow, okay? And you can use the easy guide. It's the best indication because you can have the bone structure as support. And after, you can use the 25, 60 or 50 for injecting the fine lines on the subdermal layer. Okay, you have to be above the galea, like that. You above the pain. You avoid the pain. And what I think, to have the safest injection, you have to control your injection. So you need to see the tool. You need to see your device. If you are too deep on the forehead, it can be very painful for the patient. You don't know where are the artery and the vein, and it's a little bit tricky to inject like that. So superficial, very easy with a 25 cannula because it's flexible and it can go, with the concavity and convexity very easily.
Good.
I have one question. I can?
Please.
So please, can you tell me if you change your opinion about cannulas in different indication? Do you think that it's possible to inject with cannulas for new indication that you had before? Can you raise your hand if you think yes? So I think 50-50, okay? It is very good. I convince some people. It's my goal.
In your years of experience, have you had any intravascular occlusion with cannula?
Vascular occlusion?
Yeah.
With cannula, me, no, never. I had only one, I told you, in the shin. And no, I had two. If I explain, the first one, it was in the nose with a cannula, yes. I was in London. I tell you the true story. I was in London on stage. And the patient wanted to inject the nose. I never saw her, and I have asked her the medical history, the surgery history, and she told me I never had anything. It's okay. I never injected, nothing. But she had rhinoplasty, and I didn't know. And I was injecting the nose during the training, and I saw the nose becoming white. So immediately I stopped the injection, and it was 15 years ago, no, or 12 years ago. And we didn't have Halloween on stage. So now you can believe me, I have always Halloween with me. But I just massage the nose strongly, very strongly, to move everything and the color come back. And it was, thanks God, okay. But it was the only time I had an occlusion with the nose. So I think don't touch the nose, even if it's with a cannula. If it was, if the patient had a rhinoplasty before, it's better to give to the surgeon and you know, good hands. No more questions?
Doctor, when you work in one area, do you use the same cannula or do you change?
So usually I use two cannulas for one each side, but if you prefer to use one, it's possible. It's possible. You just have to be careful of the sterile condition. So don't put your cannula in the box of the yes, and if you put on a gauzes, be careful that there is not a thread, you know, from the cotton of the gauze who is coming on the cannula. Be careful with this. But you can use the same cannula if you want. It's okay?
Any other questions here?
Thank you. Thank you for your attention. Thank you for following.
Muchísimas gracias. Yo le tengo una última pregunta, Sandrine. After you've been traveling so long, you've been using cannulas, you've been creating companies, you've been patenting products, you're teaching, you're mother of 3. What's left in your life? What is your next challenge?
To go to sleep.
Le agradecemos muchísimo a la doctora. Any dream, any aesthetic tendency you're foreseeing for the business that
Yes,
you
of
are
course.
helping with? Because I know you know the CEO of the biggest laboratories in the world. You were the first one to hold one of the most sold product, volumizing product of competitor
Of course, I
offers
think
20
always
years
about-
ago.
I
But
think-
what's next in hyaluronic, in injectables in general?
Yes, I think always about new possibility to help our patient to have better result, with safe result. I think the future is in the threads. I use a lot of threads. I love it. I think combined with fillers, it's very interesting. And I had a discussion with Emmanuel just yesterday, and I think that we have to banalize the threads because it's explained by surgeon. I don't have, I'm not against surgeon, of course. I think it's so important, but it's easy to put threads. We have threads insert into cannulas. So it's exactly the same that you can use when you inject filler. And patients are asking for it. I have the experience in my office. All patients who had threads one time come back to have others because it's efficient and it's to prevent and to correct the sagging. So I think we have to move to develop best threads, and we will see.
More cannulas plus threads.
Yeah.
And new compounding for threads.
Yes.
Yes, definitely. So we know you will be back. You told me that today. You want to come back to Mexico. It's not your last time. It was your first time, not the last one.
I hope.
We really hope you can come back with some anatomists.
Thank you.
You are used to doing
Me
and
too.
performing some live demos on cadaver on one side and patient on the other side. I'm pretty sure that you are and will be back soon to our wonderful countries in Latin America, not only Mexico. We say a big thank you to you. Just before cutting, we're going to say a big round of hellos from Mexico to the Latin American who are connected this night. Saludos hasta Brasil, hasta el sur del continente y a Centro y Suramérica. Ha sido un placer estar conectados con ustedes en vivo. Es la última vez que hacemos un evento como estos aquí en esa locación, porque a partir de la semana que entra inauguramos un centro mucho más grande, mucho más profesional, mucho más adecuado para ese tipo de eventos, con toda la asepsia necesaria, con un piso completo de educación a nombre de Auvernia y Saneo. We will be back with a better and much bigger audience next time you come. You went and saw this wonderful floor.
Yes.
And together with other doctors and with a lot of input from the brands, estamos seguros que estamos haciendo historia en Sao Paulo, que inauguramos el día de hoy, en Bogotá, que inauguramos hace 2 meses, y en México, que inauguramos la semana que entra. Un piso de enseñanza, 11 cabinas, cámaras de Netflix, 4D, 4K y en alta resolución de México para el mundo, en español, en inglés o en el idioma que se nos antoje.
El mejor.
Muchísimas gracias.
Muchas gracias.
La mejor. Un aplauso para la doctora Sebban. Con eso concluimos el OVE número 37 de este año. Muchísimas gracias a todos los que se conectaron. Semana que entra estaremos en vivo y a color el día miércoles con un tema ginecológico. No se lo pierden, con un colega de ustedes. La gineestética y la ginecología está tomando gran importancia en sus pacientes mujeres y en hombres, con la urogineco también. Así que muchísimas gracias. Fue un programa más de Online Virtual Education. A nombre de todo el grupo Auvernia Saneo les agradecemos mucho haber estado aquí presentes y ahí conectados con nosotros una vez más. Creo que fue el número 360 webinar desde el 17 de marzo del 2020 que empezamos esa loca, pero muy trepidante historia. Muchísimas gracias por su apoyo. Gracias a Carlos, al control técnico, a la traductora, a todos los camarógrafos, a todo el equipo de marketing, todo el equipo de ventas, todo el equipo de asesores comerciales y los distribuidores autorizados de Grupo Auvernia Saneo en México, en Centroamérica y en nuestras filiales en el extranjero. Un saludo profundo de México para el mundo. Thank you very much. Merci, Sandrine. And let's have a drink now. Una copita. Gracias. Buenas noches.
Thank you.